send it out in a news, I am having the worst time of my life remembering the smallest words. Newsletter. Good God. But like a digital one, anyway, forgive me. Nalini, you are on tonight. I am not going to be running any of this. I'm going to sit back and it is your show, my dear.
Okay. So I think we'll give people a couple minutes to get logged in.
I will ask, though, if everybody saw us on MSNBC today.
What?
I didn't see it on MSNBC, but I saw people post about it on Facebook.
You saw who post about it?
A few different people.
Yeah.
Hey, Madison.
Guys.
Well, so I'm glad you guys received the communication from the communication department about the login info for the meeting. I don't know who all it was sent out to. I know Philip did not receive an email, so I was able to forward it on to him, but hopefully everyone else got it.
Looks like we need Sarah. We have if Sarah's not on.
Maggie.
No.
Sabrina. Yeah.
Well, a quorum is 4, so when it turns, it's 6:01. I say there's Stephanie. She's a faithful follower.
Awesome.
So I say it's 6. Let's rock and roll. I think we have
rock and roll.
Okay, well, it's 6:02 p.m. Let's call this meeting to order.
Oh, first of all, are we recording? Are we recording it?
And action.
Commissioner Cruz, this is Amy. Can you hear me okay? Commissioner Cruz?
Yes, ma'am.
Yes, we're recording.
Okay, good to go. Sorry, Nalini. I said I was going to shut up, and there I go trying to.
Okay. All right. So I think first up, we'll do a roll call. So we don't have Maggie here, but so it's listed as Nick Day. Is it Zach Day?
It's Zach.
Okay. And Sarah, not here. So Nalini Fraser's here. Philip? Here. And Stephanie is here. Don't see Melody or Nigel. Is Nigel still on the board? Sorry, Lacey, I didn't hear what you said.
Sorry, I was on mute. No, resigned from the board.
And Denise? Oh, Denise Romero? Not here. Sabrina Shoemaker? Not here. And Madison is here.
Here.
All right. So first order of business is just want to make sure, did everyone get a copy of the meeting minutes from June 8th by email? I think that was sent out last week.
Yes.
Good deal. Philip?
Yep.
All right. So were there any comments or corrections on the meeting?
I didn't see any.
Okay. I on the board members in attendance, I don't think I was listed on there, so that might be something you could add.
Oh, that was right.
But yeah, it all looks pretty good to me. So do you have a motion to approve the minutes from last month in June 8th?
I will move to approve the minutes from June 8th with the addition of Nalini Frazier as in attendance.
I will second that.
Okay, all in favor?
Aye.
Sure, motion is approved. And then next on the agenda is CARES funding. So I think we have Lindsay here from the finance department. Is that right?
Yes, ma'am. All right, you ready for me to jump in?
Ah, sure.
Okay, so I will keep this high level for now, and then you guys tell me whatever additional information you want, and I can dive into any details you're interested in. So, Sedgwick County was very fortunate that back in April, we received money directly from the federal government through the Coronavirus Aid, Relief, and Security, or Economic Security Act, otherwise called CARES. It's also the same bill that put out the economic stimulus money that individuals got. It's the one that bumped up, federal unemployment insurance. And so it did lots of things for lots of groups, including a pretty significant allocation to states and local governments, where the local government has at least 500,000 in population. So Sedgwick County just barely hit that mark. Johnson County in Kansas also hit that mark. So there were 3 entities in Kansas that got money. The state of Kansas got about $1 billion with a B. And then Sedgwick County received $99.6 million directly, and Johnson County received about $117 million directly.
Wow.
Yep, it is not joke money at all, is it?
No, wow. No, not at all.
It is. So that funding was at least initially intended to try and prop up governments because we were all bearing a lot of expenses, right? So Sedgwick County, for example, has emergency management and it has the Sedgwick County Health Department. And so those two, also, EMS and 911.
Hey, mute yourself, would you? We're getting a lot of moving around, if you don't mind.
There we go. Did that do it?
There you go. Okay, so that money was intended to help local governments. Of course, counties tend to be on the front line just because we're actually political subdivisions of the state. So basically, we're passing on state services. So everything, like I said, emergency management, health department, community mental health. We also, like I said, do our EMS and our 911, and those are all countywide services. It doesn't matter what city you live in, you call in, and that's who responds. So that's why we were, given funding as a state and local government because we provide those types of services. And then it was also intended that we'd pass along that funding to, other entities in Sedgwick County, cities and such, because of course they have expenses too. So that's how it started. Now over time, I think we've had 7 different rounds of guidance now that have come out from the federal government that have changed the rules on how we can use that money. And in some ways it's gotten more flexible, in other ways it has gotten not as flexible. So there are 3 basic requirements that we have to spend our federal CARES money. It has to be a necessary COVID-19 related expense. It has to have been incurred or spent between March 1st and December 30th, 2020. And it can't have been included in the 2020 budget. So for example, I pretty well, eat, sleep, and breathe CARES funding now, but my salary was included in the 2020 budget, so there wouldn't be any opportunity for the county to use that money to help me out. But what wasn't in the budget was the crazy amounts of personal protective equipment that we had to buy for employees, especially our first responders, or the masks that we're all now wearing in our buildings. So those types of expenses are able to be funded. And so those are just on the county and the city side. So we did have this allocation of $99.6 million, and we had to figure out then how do we best allocate that funding under the rules that we've been given. And so several weeks ago, actually probably about a month ago now, we put out a notice of funding opportunity you probably heard about. And basically what we did is we said, hey, everybody in Sedgwick County, if you have these types of expenses, let us know, because we want to try and figure out what needs we've got and where we might be able to use that funding to help. And so we got, let me give you some specifics here. We got 131 total responses from out and about in the community, totaling about $66 million. Just within Sedgwick County alone, the government, we think we have more than $60 million of expenses. So when you look at 60 million and 65.6 million, it's 125 million. Last I checked, that does not equal 99.6, right? So what we learned through this process is there are more needs in the community than we have capacity to fix. And so certainly what that means then is the commission wanted to prioritize those dollars, right? Get them to the places where maybe there aren't other opportunities. Some of our hospitals, for example, get provider relief funding for Medicare or Medicaid because they've lost some revenues. And so maybe that's not the first place we look to put this money. Maybe it's more the community-based healthcare centers or those small mom and pop mental health type service shops that get those funds, as opposed to those larger entities that might have access to different pots of money. So we went through that exercise. We have engaged a firm called Witt O'Brien's who's helping us on this. They're actually helping dozens of government clients across the country to make sure we're documenting our expenses, to make sure we're assessing whether they're eligible or not. Of course, because it's federal money, it comes with a whole lot of strings, and so there's a whole set of regulations out there called the Uniform Guidance that we have to make sure we comply with, and everybody else who gets money, that they comply with that. So this firm is helping us do all of that. So they've been invaluable, and they helped us go through this process and develop what we're calling a spending plan. So that was adopted by the commission last week, and I will tell you it is really high level. We know that things continue to change. We just saw data today about COVID-19 in our community, and the number of those cases is spiking, right? And so that means that over time we may need to shift resources more to pandemic response, immediate direct response, as opposed to maybe trying to help deal with the after effects, which is maybe where we thought we were when we were developing this. So I say that we have this plan, and I'm more than happy to share it with you, and I'll walk through it briefly. And certainly we'll yield to Commissioner Cruz if she has anything she wants to talk about. But this is just the plan. Now, of that plan, we allocated $99.6 million. We also have heard that the state is going to give us another $9.3 million from their allocation associated with the very high unemployment that we're experiencing in Sedgwick County. It's called impact funding. So we are trying to determine now, and we'll be using a survey to reach out to the business community to understand where is the greatest need and how can we help. So that will be on top of the $99.6 million. So in this plan, we allocated $60.5 million to Sedgwick County government. Now, of that, the single largest portion is for testing and contact tracing. Because what we understand from businesses and from schools and from everyone else is we need to know who's healthy and maybe who's not, so that we can get those folks who aren't home. We can get those people who maybe are in doubt, who maybe were exposed. We can get them tested quickly, and when we find out they're negative, get them back to work because we know we're having that huge economic hit. So that has been a high priority. Another big priority that we allocated funding for was $6 million for courts. I don't know if any of you have driven by the courthouse lately and seen all of the tents lining up on our front lobby or on our front sidewalk, but that's where traffic court is being held now. And so you'll see at 8 o'clock in the morning, just, potentially dozens and dozens of people socially distanced out on the front lawn trying to pay their tickets or get into a diversion or something like that. So we know that there's a huge backlog in the court system because our systems have been shut down for so long and aren't doing business as they typically do. So we have allocated some significant funding there to try and address those needs between now and the year and I see Commissioner Cruz, so I'm going to zip it.
Now, just to point out, all of the money that has been allocated into these buckets is, while it's a plan, it can be shifted around. So one thing I want to think about, and one thing I'd love to hear your feedback would be, $6 million for our court systems. Is there any sort of tickets that we could get rid of, or something that we could, how could we rethink every part of our court system right now, so that if all we had was $6 million left, now I agree they're going to need some money, I'm not saying that, but if that's all we had, what could we allocate towards schools or mental health, or what could we allocate that money toward? Because I think we're going to have to be, I'd just like to pose that question to you all. And do you get where I'm going with that? Do you guys have any questions as far as that goes? Seriously, nothing? Come on, if you have like a small ticket, don't you want it to go away? Like, couldn't we divert our resources in another direction? I mean, I'm trying to get, I need to be quiet.
Just to try to follow your train of thought there, are you saying potentially to forgive those small tickets, or tickets with small fines?
Like amnesty for low-level crimes. That's what I'm asking for. Is there a possibility to, if we have a backlog of cases that's taking us forever and a day to get through, which is why we need more money, is there a way to figure that out?
And by giving that amnesty, then we're lowering the burden on the courts so that we are not having to allocate that money from the plan towards courts so we can use it for something else. Is that what you're getting at?
That's exactly right. And I don't know that it's possible, and I don't know that that's what we would want to do. We would need to speak to our district attorney. We would need to talk to our chief judge. We would need to, these are questions that we need to ask, the ones in the trenches, Ellen House, doing all this work. But I think that that's something that we could consider when we're in the middle of a pandemic. Our most important thing is to make sure people are healthy. But if we, want teachers and students to go back to school along with ancillary staff, I mean.
Do you know if there are any other local governments that are doing that?
Local governments
that are forgiving? Yeah.
I don't know. Lindsay, do you know?
I don't, but there are a number of resources out there we can go and do a research project on to try and get that answer.
That's just something I want people to think about, because, Lindsay, do you have that spreadsheet that we could share to them?
Yeah. Can I forward it to you? I'm sorry, I don't have the listserv for everyone on this call. My apologies.
So let's make her the host, or send it to our host.
Oh,
and
perfect.
She'll.
Let me find it really fast on my desktop, and then I will try and take over.
Lindsay,
you guys can see how fast I am. I'm sorry, can you say that again?
This is Anissa. You can forward it to me and I can share it.
Oh, hi, Anissa.
Hey.
You're covert and in the background.
I am.
She turned her camera off so we can't see her.
Oh, that's not as fun, but I understand.
It's kind of dark in here.
Now, Commissioner Cruz, are we talking just like traffic fines or fines across the board, like low level misdemeanor type deals? Like, take for instance, say like a small level possession or something like that, which, normally you might have to take maybe a court appearance where you could say maybe a first offense would be like a fine or million fine, something like that. I mean, if we could do something like that, I know that's kind of like, I don't know. I'm thinking maybe fines versus court appearances would be a lot better. I mean, if you're talking across the board, not just traffic, I mean, I think that would save some space.
I want to reduce the burden on our court system.
Right, right.
And, you know, I wonder if that's something that we could even, that's a subject we could even broach, and how it would, you know, I mean, what's being shared on your screen right now, Lindsay, do you want to explain that?
Sure.
Since you're so good at it.
I will talk quickly. Anissa, is there any way you can make it just a teensy bit bigger? I'm not gonna lie, I'm a little blind the older I get.
You have this memorized, Lindsay. Don't even lie.
What?
You have this memorized. Come on.
You're really cute. No. Maybe I probably will by the end of this, but I don't yet. Thank you, Anissa.
You're welcome.
Okay, so if we scroll up to the top here, you can see the total money, $99.6 million. That's the Sedgwick County CRF portion. Off to the right, we have the state CRF portion, $9.3 million, but we're not going to spend a lot of time on that, I promise. So looking at the county regional government COVID-19 response costs. So each of these categories is something that we have identified as a need based on essentially a needs assessment that our departments took part in a couple weeks before we did that big community-wide needs assessment. And so we use that exercise to help us understand how much PPE, the personal protective equipment, are we going to have to buy. Everything from, you know, you don't think about it, but the Regional Forensic Science Center, which is our coroner and does all the toxicology and forensic work for the county, you know, they have to have head coverings, feet coverings, gloves, you know, everything like that. Just like maybe a health department worker would have to do to take tests. So there's a lot of workers across our system who require more advanced PPE than maybe what the rest of us think about. Plus, you know, for people like me, the county gave me 3 masks to make sure, 3 cloth masks that I wash, that I wear each day. So those are some of these needs. So we set aside some money. We intend to go after FEMA reimbursement to try and, you know, make our costs go as far as we can. But FEMA only gives us so much money, and the rest we have to match. And just recently, the Treasury told us we can use our CARES money to pay for that match, which is awesome because it alleviates a huge burden on our budget that is already going to be pretty stressed. Because of all the economic impacts of COVID on our community. Looking at the next big category, and I promise I'm not going to talk about every one of these, I'm just going to hit on the really big ones. So the next one is payroll costs, and that's at $13.5 million. Right now, that is dedicated to 3 areas of our budget only. So that is our health department, because nearly every employee there was basically taken out of their day-to-day duty and assigned to COVID-19 response, especially early on. It is also our emergency management department because they have been in basically 24/7 emergency mode since this started back in March. And then it also includes our ComCare crisis area. Not all of ComCare. ComCare is a pretty massive department, but just those folks who are in crisis, because obviously we know that there's 2 parts to COVID. There's the pandemic, and then there's the mental health component for all of the effects that our community is experiencing. So that is what comprises that big amount. As you scroll through that, you can see the different things and the descriptors on what it is that we're assigning. Again, that next really big cost is down in court programs. And certainly, to Commissioner Cruz's point, I think there's a lot of good opportunities on the criminal side to look into things, but this also includes impacts for our civil side because, you know, divorces and custody arrangements and civil lawsuits and things like that have been, you know, those aren't as urgent as life, limb, and property, right? Your public safety type crimes. So those have a big delay too, and we'll have to figure out a way to fix that system. And then this also deals with all of the downstream effect of that. So we know that if inmates aren't going through the system, then they're sitting in the jails longer, and that costs money for medical services, food, and all of those things. We also know that with COVID-19, it spreads in correctional facilities much more easily because it's congregate housing. So we are frequently paying, you know, upwards of $65,000 each time we go through and sanitize the jail. And that's not even counting all the cars that our officers are using to transport patients that have to be sterilized, our ambulances, our other correctional facilities. So there's a lot of cost there. Public health testing and contact tracing, again, is the biggest bulk. That's what we have heard consistently from commissioners in the community about how this is going to get us, you know, what are we going to do through the end of the year to try and keep our economy open and to try and keep people healthy. Testing is going to be a key for that. So that's where we invested the biggest single portion of this funding and over 25% of our total allocation. And then finally, EMS and public health response. Several weeks ago, the commission approved some additional, oh, I see Commissioner Cruz.
Yeah,
Yes.
one question before we move on to testing, and it's not really a question. There's a couple of different things that we are considering when testing. One is saliva testing, and then the other is the nasal pharyngeal or pharyngeal, or I give it the old college try. So those are two different types of testing. I think there might be another one with another company, but we are considering those. I think we're going to have a white paper maybe on the 29th about the difference between those two and the effects of those two. The saliva test, obviously, you don't have to suit up full PPE. You can just spit in a cup and send it in. The nasal, you have to, I mean, if any of you guys watched my video, you saw they shoved that thing up my nose and they had to be in full PPE. So there's lots of different variables that we have to consider, but it's time to, and frequency, obviously the validity of the testing, is it a good test, right? Does it work? Is it verified by science and the medical professionals? And then what's the turnaround time so that we can be able to get these tests in a really quick manner so that people can get back to what they're doing. So those are the couple of things that we're considering. I think that that's going to be the 29th, right, Lindsay, maybe? We're going to have
That's the goal for sure.
Yeah. So any questions on that, testing wise? Okay, Lindsay.
Okay. All right, so just wrapping up, then you'll see another $4 million for EMS and public health response. So we have spent some funding already. The commission has already approved the purchase of some additional like portable ventilators and IVUs and some defibrillators and things to keep on ambulances, just because we know that the folks who are getting the sickest with COVID-19 typically are showing up with some other pretty significant health conditions. The commission also approved the purchase of what are called striker cots. And so basically those are electric cots. So one of the other unfortunate realities of COVID-19 is that folks who tend to be obese tend to maybe get sicker. And so those folks are also a little harder to transport. Some of our EMS paramedics are itty bitty. And so having those striker cots helps them safely transport those patients without hurting themselves or potentially hurting the patient. So those are some acquisitions that we've made that way. So that in total is how the county has thus far planned to spend its allocation. And again, we fully expect this to change, maybe at least on a monthly basis, maybe even more often, just depending on what's going on in the community, what needs we're hearing about, and what we're experiencing. So that's the biggest chunk of funding. Then we get into the individual program areas. So we have 20 cities located within Sedgwick County. And so when we did a needs assessment with them, we got feedback from 13 of those 20 cities, the largest one, of course, being the city of Wichita. And when we looked at those grand totals for the 13 who responded and applied it against all 20, we came up to about $10.1 million worth of needs for those cities that weren't being addressed through other means of funding. And so that's pot number 2. So pot number 1 is county, pot number 2 is for cities. And so we're going to allocate that based on population, which is just exactly how the CARES funding was allocated to us in the first place. Looking at the next category, public health, we've allocated about $6.5 million for those needs. The biggest portion within that you'll see is the senior care, assisted living, and skilled nursing homes. Certainly the news has been all over it, but it seems to be that our assisted living centers, our nursing homes, tend to be where we're having the most clusters, and certainly where we've seen deaths occur. And so The commission from early on has been clear that they want to try and get some funding designated to that area. We didn't have a whole lot of those entities actually respond to our needs assessment, and so we've allocated $3 million, but certainly that's a category that we expect to change as we go forward, and we start to see what the true need is there that's identified that's eligible for this funding. Also within that category, you'll see public health care initiatives and healthcare providers. And so those categories are things that we're working through to refine now based on the notice of funding opportunity, those needs assessments. This week is actually the week that we're going in and delving in and trying to flesh out the scope of each of those types of programs. We're trying to figure out, do we want to try and limit the first round of allocation that goes out to make sure we don't have one entity come in and just wipe out all of the funding with the need. And so there's still quite a bit of work going on this. We do have a draft 15-page summary document that outlines all of this that we're going through now, and it's going to get much longer and much more detailed, and then it's going to be posted on the website for everyone's enjoyment by next Monday, and so we'll have a little more detail on what people can expect, who are eligible entities, and how we're going to make sure that it's fair and we don't have all the funding just get exhausted in one fell swoop. Moving then to social service providers, certainly one of the things we've seen in the news and one of the things that we heard a lot about through the notice of funding opportunity is our vulnerable populations. Certainly minority communities right now are having a disparate impact from COVID-19. And so that is something where we wanted to make sure we had good communication strategy funding, we had good response efforts, made sure we have PPE and masks and things like that to get those to those communities or those areas or those churches or whatever the distribution point may be, to make sure that they can get those things to our most vulnerable populations in our community. So we set aside $6 million for that. And then next, mental health. So I talked about mental health with ComCare, but we also heard through the notice of funding opportunity that there are little pockets of organizations throughout that are trying to provide mental health services and are having to do it in a much different way than they ever had to before because of COVID-19. So they're either having to do it remotely or do it differently. For example, our ComCare folks bought a bunch of lawn chairs and they're going out and meeting with their clients outdoors, sitting in a lawn chair. And so, I think that's kind of a cool way, an old-fashioned way to do things, but it seems to work, and that connection really matters to some of those folks. So we set aside some funding for that as well. Then looking at educational institutions. So this was a really, really hard one, I'm not going to lie. Through the notice of funding opportunity, we received more than $29 million worth of needs for educational institutions. Most of that was related to distance learning. A whole lot of it was tied, or a good chunk of it, maybe less than a third, was tied to PPE and things. Now, the issue why we allocated $3.5 million for that out of the total $99.6 million is because we know that schools have other funding streams. There are actually dedicated funding streams through the CARES Act. We have the Kansas State Board of Education, right? And we know that the state of Kansas received $1 billion in funding. And so we think that there are probably other avenues for these educational institutions to receive funding, whereas maybe some of these other groups can't. And so we know that our commissioners had some heartburn with that. Again, this is a plan. We're going to wait and see how this develops. And Commissioner Cruz, I will zip it.
I just have a question. So how could we tell what our educational institutions, what did they receive? How would we find that?
So there are a couple different ways.
Outside of the $1 billion that the state received, was there anything from the federal government that went directly to schools? Okay.
Yes. So, well, I don't know that it went directly to schools per se, but it went to like the State Department of Education for distribution based on population. And my understanding is, and I will verify this, but my understanding is they also took into account things like at-risk student counts, free and reduced lunch counts, and things like that, sort of like what they do with educational funding today to try and make that a little more, I say equitable. By equitable, I don't necessarily mean fair at the exact same dollar per student, but equitable based on the demographics and economic circumstances for those schools. And so, yes, there was funding that came through the CARES Act, but then there was actually funding that came through one of the earlier acts, the very first one, but I can't remember the name of them now off the top of my head, but they were one of the first groups that got some actual funding. And so there are some websites out there that show the totals, and I can go and dig into that and follow up with that information.
Yeah, it would be nice to know, like proportionately what amount of funding went where, and like if it was based on population size, like what did USD 259 receive?
Well, and actually, I can tell you what USD 259 got because they filled out the notice of funding opportunity for us.
Okay.
And that actually has it. So let me click over to that portion of my file here.
And Valley Center filled it out too, didn't they?
I'm sorry?
Center? Well, the city I know did, but did the school
Yes,
district?
USD 262 did fill it out.
That's what I thought.
So looking at USD 259 Wichita, they identified that they received 17.9 million.
Hey, Lonnie, mute yourself, Lonnie. Thank you for joining us. Okay.
Thank you for helping me find the link.
You're welcome. Okay, say that again.
Sorry. So the USD 259 received 17.9 million in its ESSER funding, and I'm going to have to look up what that stands for.
Don't worry about that. What did in relation to school districts? Valley Center is obviously a lot smaller, but what did they receive?
They identified that they received $235,000.
Okay. Was that based on like student population?
My understanding is it was what it was, but I'll dig into that and follow up with and confirm one way or the other what that was based on.
Okay, I appreciate that.
My pleasure.
Not like you have anything else to do.
You are one of my 6 bosses. I promise I want to make you happy.
Well, I appreciate all the work that you've done, and I think that's important for us to understand when in relation to everything else. I mean, kids, you know, in my opinion, and I'll just say it because I'm going to never hold it back, but I mean, our schools are vastly underfunded anyway. And now they're having to deal with a lot of this extra on top of that wasn't included in their 2020 budgets, right? And the last thing I want is for teachers to feel like they don't have what they need. And, you know, my best friend is a teacher. She's an 8th grade math teacher, and we added it up the other night. I mean, she could be around 75 students in her class in one day. And then not to mention all of the kids going through past periods and ancillary staff. And so there's a lot of exposure that's going to happen in our school system. And I think we got to protect those people, you know, and so that's where I'm coming from, how much money is going to be allocated, what's already been allocated. A lot of heavy-handed decisions here that we have to make. And I want to make sure that I make the right one, which is why I asked all of these questions to you all, so that you can help me make the best decision when it comes to allocation of these resources.
So I do have a question about education fund institutions. Is this just, we're looking at K through 12 schools?
So the way this is designed right now, yes. And the reason for that is that the state, the secondary post-secondary, so colleges are actually receiving funding separate and apart from this directly also. And so the funding that we are directing is basically, and I don't want to get super complicated on you, but the state of Kansas basically said it's going to be our responsibility to pass along funding through to K through 12 schools. And we're going to do that to some degree, but we also recognize that the state has a responsibility for this as a state institution that provides state funding. We think there is a role for them to step in and play with that to make sure that it's equitable across all 105 Kansas counties, and not just about what each individual county decides to pony up. And so that's why I say this is really flexible, because we want to see what the state does. Certainly, I don't think anyone expects to leave school districts high and dry. or even private schools. This is, so far has not been restricted to only the public school system. This is just K through 12 schools in Sedgwick County. And I'm sorry, Commissioner.
Do you have a list? So it's the school districts where their headquarters falls in Sedgwick County. So how many fall in Sedgwick County again?
So there are 20 total school districts that cross into Sedgwick County lines, but only 10 of them we were able to physically go through and identify their physical address. And I can pull that list for you. I don't have it handy, and I don't know where we saved it, so I can't easily navigate to that one. So I apologize, but I can get that one.
That's cool.
I had a question as far as the funding goes. With these applications, as far as like the city, say like me, I'm with the city of Park City, and we turn those in. Or as far as like the applications, are these, I mean, is this something that's already been approved as far as like what our cities have turned in, or is it something that's going through like an approval process?
That's a great question. So what was created initially was basically a needs assessment, and we used that to determine the spending plan. And
Okay.
so what was approved last week was the spending plan, and so what we have decided we're going to do based on Commission's approval is we have allocated funding for cities based on population. And so as soon as we get our grant portal loaded and we can go in and get everybody's, you know, basically you've had your audit and all of the technical stuff we have to have as a grantor, then what we will do is give 50% for cities only. We will do 50% of the allocation as a direct payment initially, and then once cities are able to provide documentation to show that they've already spent all of that 50% on valid purchases, then we'll go into a reimbursement basis where we'll continue to take application and we'll reimburse. And so that system should be up and running on Monday, a week from today. And we'll have training videos and documentation and stuff to really put you to sleep if you're ever looking for a nap. So that's kind of how we're thinking we're going to go through that process. Does that answer your question adequately?
Yeah, it answers great. In fact, we've got a city council meeting tomorrow, so I imagine that the administrators, I imagine he'll give us a briefing tomorrow at the council meeting. So, no, that answered it tremendously.
Okay,
I know I've got a crew of guys that ask about it all the time. So
I don't blame them. I completely understand this is a lot of expense everybody's having to bear on their own without any way to know it was coming.
No, thank you. Thank you very much for the information. That's awesome. So
my pleasure. Okay, so Anissa, can I get you to scroll down just a titch more, technical term? I found this out on the Department of Education's website. This shows by school district how much of that federal CARES money they receive directly. And Anissa, I think we probably need to go to the next page. I'm sorry. Let's get into the 260 range. There we go. Now I'm seeing some Sedgwick County schools. So you can see what Sedgwick County or what Wichita received there was 17.9 million. Derby was at 660,000. Hayesville was at 534, etc. So we can get this link sent around also. Okay, so any questions on that, or is it okay if we switch back to that spending plan? Okay, let's hop back to that spending plan, please, Anissa. Thank you so much for driving for me. Sorry to make you do that. Okay, so you can see again what we have for now for educational institutions. Next, then we have the reserve. And so what we know is that we don't know a lot of information. And so we had hoped to have a bigger amount set aside for discretionary needs. But unfortunately, after we got through trying to address those highest priority items, this is kind of where we got left with $2 million. And then, of course, we've set aside a reserve of $10 million that we expect to get incrementally smaller as we progress through the pandemic and we start to realize maybe we don't need to hold that much back, but if it turns out that we need more in testing, or if it turns out that we need more in schools, this is going to be the source where that money comes from. We do have to have commitments for expenses on the books by 12/30 of this year. Originally, the guidance said money had to be out of the door by then, which means we would have had to have gotten the product, gotten the invoice, made the payment, and everything by then. Thankfully, they have lessened that a little bit, and now we just have to have basically the contract in place and the service rendered or good received by the end of the year. But then we still have 90 days after that before we actually have to process the invoice, make the payments, and do all of that. So that was very helpful. So the final category you'll see is economic revitalization. That's that $9.3 million in state funding that we have yet to figure out exactly how we're going to recommend to the commission how they spend it. We do have that intention of putting out that survey this week to try and understand through the business community what it is that are the greatest needs. Is it PPE? Is it, like masks and things for their employees? Is it trying to put together kits for them with masks and hand sanitizer? What is going for, what's going to be the most meaningful way to provide relief, recognizing that unfortunately we aren't able to use any of this money for revenue replacement. And of course, that's where we think our local businesses are suffering the most, is just the impact of this on their business generating opportunities. So I said that was high level. That was probably way more in depth than any of you wanted to go. So my apologies for that. But that is some of the general information. Like I said, this will all be rolled out and available to the community next Monday. And certainly we plan to have lots of discussion on this going forward. Just to follow up, once people are able to put in applications, that'll be reviewed for eligibility. We have a team that is made up of external members, including your own Melody McCray-Miller. It's a 7-person committee that's going to vote to make recommendations to the commission, and then the commission will approve literally every dollar of expenditure that goes out, recognizing that at the end of this, anything that is misused, we have to pay back to the federal government. And so we really, really, really don't want to have to use county property taxpayer dollars to do that. So we are doing our very best to make sure that doesn't happen, which means a little more process, but that's for the safety of all of us in the end. So with that, I'm happy to answer any additional questions you got.
Well, I think that was a great overview walkthrough because I am looking forward to seeing the draft posted next week for the allocations. But where can we find that?
So it is going to be, we actually already have a banner, a pretty fun banner designed for the very front page of our website. That's going to be ready to go on Monday. And so you're just going to click on that front page of sedgwickcounty.org. And it's going to take you right to the page with all of the information. And what we're also going to put out on that same page that day is a list of all the other resources that we have found for grant opportunities, because maybe this isn't scratching the itch that somebody needs. I thought it was really cool. We found some grant opportunities for local artists. And so we have all of that compiled, and we'll be posting it and making it available all out on this big resource page.
Yeah, because as I go through that on my own, I think it would be, there's a lot there. So I think that you gave
Yes, there is.
Yes,
and we're going to do some videos on like what to expect if you're going to apply. So just a real quick, less than a minute, here's the process, and then some deeper dives into each of the things and do some demos of what it looks like as you use the system. So we are going to do everything we can to try and make it user-friendly, but I would encourage you, if you're going through it and something doesn't make sense to you, please let us know. We do want this to be user-friendly.
I thought it was very wise that you all included the reserve for some of the things that might come up along the way, because we are so still learning about this and figuring out what we need.
Absolutely. I agree wholeheartedly.
Lindsay, I really appreciate all the hard work that you've done. This has been a tremendous amount of work, as you all can imagine, to understand the ins and outs with all of the changes. So, I mean, I really can't thank you enough, Lindsay. I know that you've put in a lot of hours. I know that it's incredibly tough to work day in and day out since when? March? February? March? I mean,
March, thanks.
yeah, we're all getting a little crazy, if you can imagine, but it's very important that we get this right. It's very important that we take care of the most vulnerable and we get the things accomplished so that we can, I mean, we're in a pandemic. We have to do, I mean, there's too much to really even think about, and kind of we're making decisions on the fly. But I know that you're being very thoughtful. I know that you have done a tremendous amount of calls with tons of people. That's why I don't even want to give you any more work. If I can help you, please let me know. But it's very important that I make good decisions. It's very important that we really listen. And so I can't thank you enough.
Well, thank you very much. You have an awesome team that's working on this, and I will pass along your thanks to them because they're doing the bulk of the work.
Nalini, what's next? Or anybody have any questions?
Yeah, does anything else for Lindsay before we?
Okay.
Thank you,
Nice
Lindsay.
seeing you all. Good luck.
Thank you very much.
All right,
Thank you.
bye all. Thank you, Anissa.
Bye, Lindsay.
Bye.
Bye.
All right. Does anyone have any other business they'd like to bring to the board?
I've been noticing the signs.
Yeah.
I guess I was wondering, I know we planned on a whole thing before all this happened, and I was just wondering how that process was going. I guess with all the changes.
Good question. I'm curious.
Are you talking the advertising the county has done? Are you talking the You Matter signs?
The You Matter signs. I'm so sorry. Yeah.
No. Well, I actually have a lot left. So I was able to raise money for a whole nother batch. I put up my own money first, and then I raised money to get the next batch. And I have about 100 signs. So if you guys want to come pick some up, I've really been just bombarded with a lot of other things. So I will be happy to give you my address. You can come pick up 5 or 6 and pop them in people's yards or give them away to whoever you need to give them to. I'd be happy to provide you with them. I just haven't. I still have 3 masks that I need to give to. I've been slacking.
Yeah, that'd be great. I know several people that I could give the signs away to, so you just holler. So
okay, well, you guys are welcome to them. You just let me know how many you want, and I will give you my address. You have to come pick them up.
Oh no, that would be great. Now I could do that.
Okay, cool.
Yeah, I definitely have a list of people that were interested also.
Okay.
Are you still taking fundraising? Like, are you taking donations?
All of the funds, I don't know how much money I have in my account. So all the money that I've raised is going into one account just for You Matter. And so if I guess if I raise enough, I'll buy more. And if I don't raise enough, then I'll give it to somebody that maybe you guys could help me determine who we could give it to. The other thing I wanted to talk about was the money that we have. So since we've kind of saved money with, we haven't been renting a space, right? Because usually we would be renting a space to hold these meetings, but because we didn't rent a space, there are, different things in our community that we have $1,000 allotted to our district advisory board. We don't have to spend it. Okay. So I'm not telling you have to spend this. I'm just saying that the $1,000 is there. I think probably take or minus some money because of the spaces that we did rent. I don't know. We'd have to check the balance, but there are, like, Dunbar Theater has asked for a donation. There's a lot of different things that have asked for donations. So you guys could figure out whether you want to spend it, whether you want to just keep it in the coffers. that's something that I wanted to make sure that we all talked about, because just because the money's there doesn't mean that you can spend it, but there are some really good causes here in our community now that are in our district that we could help if you're so inclined to do so.
So if we don't spend it this year, would it essentially roll over to next year?
That's a good question. I don't know if we don't spend it, if it goes back into the general fund, or if that's a good question, Madison.
Okay.
And if we wanted to entertain giving it to a good cause, how do we go about doing that?
I think that's something you guys talk amongst yourselves and see kind of what you feel like as a group you'd want to support. I would say it could get very cumbersome if we, you know what I mean? I would encourage you to throw out what you want and see if the group digs it. I don't know. I think that's really good, open for suggestions.
Nalini, would you like to maybe we can share some emails before our next meeting and then maybe bring some opportunities up next time and see what everybody thinks?
Sure. And I was wondering if we open this up to like applications, or it's just things that we know about that we might suggest, or I think Lacey, you said that we've been approached already, that you know of some good causes.
So there's a couple of different things. So Dunbar Theater in our community has been raising funds. TCAM is raising funds. There's Humankind is raising funds. So many people are raising funds.
Mm-hmm.
I think that I don't know it's not a lot of money. Do you give a lot to one? Do you give a little to a lot? I don't know. I'm just bringing it to you because that's an option. But we have to account for the money that's already been spent. So we'll have to, we let Lindsay go and we should have asked her.
Okay, well, I will do some emailing and find out more about that, and we'll be in touch on that.
Is that on next meeting's agenda? Or is that too soon?
Philip, you asked about the next meeting's agenda?
Yeah, should we put the potential donation on next meeting's agenda, or is that too soon? Do we need more time?
Madison, were you going to say something? You looked like you were.
Oh, I was just thinking out loud, and I don't necessarily see things, changing. And us meeting in person in the next few months, but so next meeting we could at least just bring it up and start talking and deciding. We don't have to make a decision, but.
And maybe it's an award that is in December. Maybe it's like a Christmas bonus. I don't know. Everybody likes that. And again, guys, you don't have to spend the money. I'm just saying that if we have the opportunity to gift an organization because of the money that we've saved by not meeting in person and all those kinds of things. I know that McAdams Park, where we normally meet, they were looking for, maybe it's an ice cream truck that we sponsor, and we get kids to come and have free ice cream one night. What could we do as the District 4 Advisory Board to get more people involved in what we're doing? Maybe it's a voter registration drive. I don't know what it is. I'm just throwing out ideas here for you guys to, anything's on the table. I think if you guys want something, you bring it to the table, you vote on it.
Okay, we'll look out for some messaging and we'll try to gather some input. And if we want it to be on the agenda, do we let Kate know?
Yeah, Anissa could probably, she's kind of running the ship. So we'll go through her because look, she's got this going tonight, and I wish we could see her face, but it's dark in there.
You know she's there.
She's like, oh.
Okay. Well, Anis will be in touch. I think that's a really great idea. But we'll see what the group has to say.
There she is.
Yes, if you just want to let me know, and you can reach out to Kate too, and she can forward it to me. I can get that on the next agenda for you.
Sorry, I didn't catch the end.
I was just saying if you could forward that to Kate, she could get that to me too. Or you may have my email address. I sent the agenda out last Friday.
Well, I'll make sure that everybody gets it. Nisa, we'll make sure.
Okay.
Yep.
Thank you. I did have a question for Lacey. So, is there anything that you want input on?
So we have our budget coming up. We are going to, I don't have the dates right in front of me. I could look here. We do have a couple of public hearings coming up. Madison, you might remember last year, I kind of threw a loop with $125 additional for senior services last year that got allocated. This year, with COVID-19, I haven't really been sort of trying to throw anything for a loop, but I will say this. In light of Black Lives Matter protests, in light of the discussion about police, one thing that we're doing in our community is the ICT-1 program. So for those of you who aren't familiar with it, it is a paramedic, a social worker, it is a police officer. And what they do is they triage calls that come into our 911 service. And instead of sending someone to our jail system or our emergency system, meaning our ER, they are diverting people, or they're taking care of the person in place. So our ICT-1 program is actually really, we're not spending money when we take care of people in place because they're not going to the ER and they're not going to our jail system. So thank you for pulling that up. Yes, this program in itself is helping our community in a way that's new and fresh and innovative. We are saving money in the long run. I could go on for days, but right now the program is currently only running one shift, 10 hours a day, 4 days a week. If you're in crisis, you aren't probably, let's just say that a crisis happens anytime. So it's not necessarily going to fall into that time frame. So we need a 24/7 group. And in order to do that, because the program is split between the city of Wichita and Sedgwick County, we would need additional funding with our partners with the city of Wichita to fund this program for 24 hours, which means kind of 2 teams. And I don't necessarily know if that would even fit our 24-hour schedule, but we need to think about funding things like that. It's not about defunding the police. That's not what it's about. It's about finding innovative programs that help the people in need that our police would then normally be in. Like, we have a police force that is tasked with doing a lot of things, being a social worker, being they wear a lot of hats. And if we can help them in a way with a program like this, why don't we do that kind of thing? And I guess I've just kind of been fallen down by the wayside since, getting support for this, because we fund, I think it's about $544,000 for 2 teams. And given our budget shortfalls with both the city and the county, there's just not a lot of money. And so understanding the program, being an advocate for helping people get the care that they need in the place where they need it, instead of going into jail or going into our emergency rooms. Nobody wants to go to the emergency room right now, right? I mean, you could contract a virus that you never thought you'd get. So, or going to jail. I mean, if someone is just like mentally ill and they need help and services, let's figure out ways to help them outside of the normal system. And ICT 1 is a really good starting point. It's already there. If we could get a whole nother team, you know, being advocates for that. We also are looking at, we're doing an environmental study. So we're buying into a wind farm in Oklahoma. I mean, the county is responsible for three things: public health, public safety, and public works. That's what we need to focus on: public health, public safety, public works. And innovative ways to do those three things is what I'm looking for you guys to think outside the box. Help me understand what other counties are doing around the nation. How are they spending their dollars wisely? The MAPS program in Oklahoma City, they have an incredible program around behavioral health. They just levied a tax, I believe, which is paying for a lot of things. And I guess I'm not talking about raising taxes. I get it that some people are saying that, but that's not what I'm talking about. I'm talking about thinking about innovative ways to move the needle like you've never seen before. And if you can be a part of that, if you can bring those ideas to the table, that's what I'm looking for.
You know, Commissioner, you made, I guess you just opened my eyes when you were talking about ICT 1 in a whole different, I guess, just a whole different light. You know, when you were talking about that, and you were talking about when you're like, you know, not defunding police, you know, and I think especially in this time, you know, so many people get wrapped up in party politics, and that's one thing that I've noticed, especially in this day and age, and that's where I've pulled myself completely away, and I'm buying into, you know, my own train of thought. And I think if more people would put it and would describe it and look at that type of system that we're doing right now, where, you know, we're dispatching the social worker, the MT, you know, the firefighter and the police officer right there, they would look at a system like that and say, okay, you're not defunding police. You're taking a whole system out to a scene, and you know, you're dispatching a unit out there and you're taking care of a person right there. You're not defunding a police, and you're not taking away. You're actually bringing it to somebody. I mean, you made a whole lot of sense right there. And I mean, that's, I don't know. I mean, I really appreciated that right there. So that was a good point. Really good point. So I could totally buy into that.
Yeah, I think it's just educating and being an advocate for a different way of thinking.
Right. Right.
Yeah, so that's really important, and not being afraid to say things that are out of the box. You know, when I brought the solar panel initiative last year, I know that it was probably a little soon, but it saved money. And so now this year we're buying into a wind farm, you know, so maybe a seed that was planted last year turned into something the next year. And so I really want you guys to be bold in your thinking, be creative in the way that you approach things. That's really what I'm after, and bold ideas that you aren't afraid to say out loud, even if they seem a little nutty. You know, that's what I'm looking for.
Wait till you get the nutty ideas, and then
Right. So
all right. Well, is there anything else from any questions for Commissioner Cruz, or Commissioner, if you have any questions or thoughts for us?
No, I just want to thank Anissa for being on the call today, for kind of getting this going. I would like to, I know that we recorded it, so as scary as sometimes that is, we're going to send it out and we're going to post it on social media, share it with folks, talk about the CARES funding. I think there's been a lot of confusion around that money. What I want people to understand is that we are trying to allocate it as intelligently as possible, understanding all of the rules that keep changing. First and foremost, it's about getting this community healthy and back to normal, as if normal was a thing that was good. But yeah, so share it with your friends, talk about masks, as uncomfortable as they are, and as much anxiety that I feel when I put them on, as they fog up. I mean, there's just a whole plethora of reasons why I don't want to wear them, but I do because it's important. And just today on the call with the hospital systems, we have 54 people in our hospital system. I don't have my list of all of the numbers, but it was really alarming, and it was kind of shocking to hear. You know, we have one hospital system that is already in surge planning. They had 10 beds that they allotted for COVID, and they have now exceeded that number. They have 13 people in ICU. So this isn't about fear, my friends. This is about science. This is about a virus that we don't know a lot about. It's in its infancy. I am not okay with one person dying. I don't care. I'm not okay with that. And I think if it could be avoided, then we should avoid it. Yeah. So I just, as uncomfortable as all of this is, please understand that this is a public health concern, right? Public health, public safety, public works. That's our job. And I know that this has been sort of polarizing. I get it. And everybody was talking about freedoms and all of that. And I understand. But at the end of the day, I'm not okay with a 1-year-old being in our healthcare system right now. I'm not okay with 8 people under the age of 50 having this virus, when everybody is talking about it being a long-term care problem or a cluster with aging population. It affects everybody equally. And the people who come into our hospital system are more acute, meaning when they're they have to be cared for more intensely by our healthcare professionals. We have 21 people out, 21 healthcare professionals out of our hospital system at Wesley. That's just one hospital here. The numbers are really insane. And we knew that it was going to happen. It's not like we're special, right? It just has crouched in on us. And the last thing anybody wants is for anybody to have to make a choice about who lives and who dies. And you think that's being dramatic, but it's going to happen pretty soon if we don't stop the number of infections that happen. And I'll get off my soapbox because I really just want for people to understand how important it is about masking. And that's all. I'm going to get off. I'm going to stop.
No, definitely agreed. And we need to manage it in the best way that we can through the county, through the city, through our own personal advocacy, or what we're doing, our own habits that we are going out into the world with. So we do appreciate you, Lacey, like so much for being an advocate at your level.
I appreciate that. And also there are a couple of, so Denise and Maggie, I don't think are going to be joining us anymore on our advisory board. So if you guys know of anyone who wants to join our advisory board, please spread the word. Let them know that we have some money we're about to allocate, maybe not. There's all sorts of brainstorming we can do to make this county better. Each one of you showing up each month and sharing your thoughts with me, please send me emails. Like if you find articles or information or whatever that you think that I should read, please send it to me because I will read it. But I'm done talking.
As if you don't have enough to read. Okay, so it looks like our next meeting will be August 10th, and I hope we do continue with the digital meetups for right now. I'm sure those details will probably be decided upon closer to that time. So thank you all for being here. So it is 7:14 p.m. We have a motion to adjourn.
I move we adjourn.
Okay,
I'll
so we have-
second.
All right, sounds good. Meeting is adjourned. It's good to see you all. Thank you.
All right,
Thank
thank you.
Thank you guys. Have a good one.
Hey, you too.
Have a good night, everyone. Thank you so much.